The greatest gifts I've ever had in my life were often the most horrendous, tremendous challenges, health-wise, that brought me to what I know today. Lisa Rooney is with us now. She might concur. She might disagree violently. No, she won't disagree violently. Lisa Rooney, welcome back.
Hello, how are you?
Oh, so good to see you. Makes me happy every time I see your smiling face.
Oh, you too, right back at you.
So anyway, yeah, anything you want to comment on regarding the vaccine skepticism awareness now and or the things we're going to go into, of course, with our discussions. And we were talking before we went to air about there's just some buzz in the air. Homeopathy is definitely on the comeback trail. I'm getting a little, I don't want to get cocky, but I'm getting more comfortable with saying, yeah, we are on the mend.
Yeah, and it's coming out as a viable option because people are looking for something different. And as we've talked about, there's really no human condition that homeopathy can't touch in some way. Doesn't necessarily mean that we're going to affect a complete cure or a complete uprooting of a condition, but we can move somebody to a place where they can go ahead and live their life normally, despite whatever condition they have. And I think, homeopathy has the ability to uproot many, many, many conditions. And people are looking for those options. I love that they're now saying did you say it was 50%?
Well, in certain cases, it was like 57%. And they kind of, Politico did it. So they're obviously going to take a political angle. They said, if you voted for Trump, 57% of you are skeptical about vaccines. If you voted for Kamala, it's closer to 37 or 38%. But as I pointed out in that article, they didn't give me a percentage, but the minorities within that Democrat Party vote were higher in the skepticism scale. But I'm afraid that they didn't want to share that number because it shows that they're losing control of the messaging even among their followers.
It's probably a lot higher than what we even realize. And I think that's amazing. I mean, we should have been having this conversation a long time ago. I remember when I went in for the beginning stages of, the pregnancy. I was pregnant and the prep, and we were meeting with the doctor, and then we were going through all this stuff, and the vaccine conversation came up, and they wanted to give my newborn baby, I think it was a hepatitis B vaccine at birth. And I was like, why? I mean, there was something about that didn't make any sense. And I wasn't an anti-vaxxer. I wasn't necessarily, I hadn't even identified that way. I was definitely already on the holistic path because my journey had been through chronic fatigue and candida and, recovering from that. Talk about a challenging recovery. But I want us to be thinking about things like that. Like, why would it make sense to give a newborn baby a hepatitis B vaccine? And that was the first alarm for me. I was like, wait a minute, what? We're doing what? And then it just opens up the door and you start thinking about it. We just need to be thinking critically about what the powers that be, and I put that in quote because we have the power.
Yes.
But the powers that be, what they're telling us that we need, and especially with moms. Moms know what their children needs. They know intuitively, they know instinctively, and it saddens me that intuition has been suppressed and it has been taken away, and it has been. I mean, women have been gaslit in every way that you can possibly imagine, especially when it comes to our health and the health of our children.
Yeah, and Kennedy's words right there that we play that little clip are so important because I've found that the challenges I've gone through have actually been gifts, even in the middle of while I'm complaining about them. Now I'm better off at going, all right, it's happened enough times that, this might suck a little bit, but I'm like, there's something important happening here. Let me embrace it and be grateful for it, even though I'm not sure why it's happening. And then you find out that you get on the other side, you're like, wow, that was a strengthening, a learning, whatever it was that helped me transform and unfold. And I like to say every time we hear the powers that be, the powers that think they're all that, or the powers that used to be, so we can defang them because it's our own illusion that enforces their artificial strength, if you will. And we start talking about them in the terms that make them look as silly and foolish and egotistical as they are, then it loses the power they once had over us.
Yeah, and that's why I focus a lot with my coaching clients on listening to your intuition and knowing what your body is telling you, getting those signals down. I had a conversation with my daughter just before, about an hour before the show and she was trying to make a decision between two big things. And I said, well, what's your body telling you? Where are you feeling tension and where are you feeling expansion? Where do you feel calm? Where does it feel not right? We have to be able to tune into our bodies because that is the ultimate power. That is what is going to tell us what we need to do. And depending on what your perspective is, you know, it could be God speaking to you. It could be the universe speaking to you. It could be your own intuition, you know, whatever it is, that's where our power lies. And our bodies will never lie to us.
That's right. You are such an awesome mom. I hope your daughter appreciates you.
She is super sweet. We get regular, thanks mom for being so great.
Right. She doesn't go, Mom, just tell me what to do.
She does that sometimes, but not so much, not as often. Sometimes she does, but not as often. And I think, you know, it's the young adults. I love the young adults. I love working with young adults because they're differentiating and they're trying to figure out their way and they're trying to establish themselves as their own individual, you know, human being within their family and within their new community. I do a lot of normalizing their struggles with them. And, you know, to the point that you were saying, the struggles, the challenges that we have, it's pretty normal to have challenges throughout life. It's really normal to have anxieties and griefs and depressions and anger. There are a lot of things out there that it is normal to have those feelings, but we live in a society that wants to suppress the way we feel about things
or pathologize them, right? Medicalize them so we can drug them.
Yeah. So, you know, I do a lot, especially with my young adults. I do this with all of my clients, but especially my young adults is, you know, it's really normal for you to be anxious about this right now. And so let's walk through what's going on, what your body's telling you, and what tools we need to put in place to move through this.
So we are today, April 15th. We've talked about the deadline to get the course at $100 off. That we've read some testimonials that are just phenomenal. I'm telling y'all, if you don't take advantage of this, you can still get it. Well, the discount's going to change tomorrow, but for now, the RSB 100 off is believe the code to get Lisa Rooney's course on homeopathy, which again, it's rocking. And then the next question becomes, what about the $100 off consulting with you, right? We've talked about that ever since you came on board. You've been so kind and generous. Will that continue?
That will stay in place. $100 off for my coaching packages. Yes.
Okay. And is there a code that they enter, or when they talk to you, they know they came from the RSB show, so you know.
Right. Yeah. So I know. And then I just give them, when they sign on, I just give them that discount.
Okay, cool. So the coursework, now I've only had a few testimonials. You probably heard from more people that have signed up for the course. Did anyone say, man, that really sucks? This is just not good. I can't imagine that's the case, but just in case.
I mean, I haven't heard that.
Good. I didn't think so.
I would hope if somebody doesn't like it that they tell me. I'm always open to constructive criticism.
No, we would ban them.
You think I'm terrible. I really don't care, but
no, but to what you're saying too, I like a little bit of constructive criticism because they're paying attention, even if it's something silly that we might think, oh, they heard it. They called me out because I mispronounced the word. It's okay. Yeah. That's good. You actually heard it. I should mispronounce words just to see if you're paying attention. Right. Sometimes the only way we get attention, it's negative, right? But the point is, what is in your course is dynamic. It's accessible. It's opening up the possibility that people, don't have to be intimidated by homeopathy. Doesn't mean that you take the course and suddenly you're a 30-year studied homeopath, but every step, whatever you want to achieve, I think that's a great starting point for people.
Yeah. And I designed this course really to give people confidence, especially in those acute issues, because as you and I both know, a mismanaged acute can turn to a chronic issue. And so if we can handle the acutes, if we can put this in the hands of mothers, students, budding homeopaths, even functional doctors who want to know more about homeopathy, or nutritionists, or any other practitioner that wants to know more about homeopathy, wants to go through the journey, understand the law of similars and Hering law of cures, and how to dose and how to assess potency, and what are the top remedies that you're going to generally be using for these acute issues, so that we can handle those acute issues and prevent the chronics from taking hold. So
Yeah.
that's what the course is really designed. I do talk about chronics within this course, but it's really designed to get the people who take this course very familiar and have them very familiar with the remedies, very familiar with the conditions and how to treat them, and with all of the, you know, the keynotes of the remedies so that they know what to do. And I tried to take away all of the common things that I struggled with as I was becoming competent in utilizing homeopathy for my family.
Well, you're making the path easier for others, and I think that's a wonderful gift. Now, for those that want to go further, okay, you can go further. But there are a lot of folks that just, hey, I just need the basics. What are we going to say? Nope, we're not going to let you have the basics. I'm like, that's elitism. I don't like that in any form, much less homeopathy. But if you want to go further, there's always opportunities to go further. By the way, Supernon, if you can bring up the vibrantlife247.com website, just so we can show everybody what to do, what to click on, because this is the deadline day. If you want to get that 100 off of the course, I want you to, no excuses like, oh, you didn't show me how to do it, I couldn't figure it out. I want you to see it. So go to vibrantlife247.com. Superdone, if you can bring that up on screen, then we can click through and show everybody what to do. So there's the site. So where do they click first?
So go all the way down to the bottom of that.
Scroll down?
Yep, okay. Scroll down. Keep going.
Looks like it's stalled. Oh, there we go.
Yep. And right there where it says learn homeopathy at the very bottom.
Beautiful. We got it. Click on that.
And that will take you right to the sign up.
So it says enroll now right in the middle there. Yeah.
Yep.
Click that. And there you go. And enroll now. So you got, I think it's ridiculously inexpensive to get this course. So thank you for pricing it that way. But when you check out today, there's a discount code. You see it there?
Right under the summary.
Right under the summary. Then you would enter RSB 100 off, correct?
Yep.
There it is. And then it should apply. You'll get $100 off of that. And let's see what happens here. Now that's going to go away tomorrow. Yeah, you look at that. 100 off. It's $247. Best deal ever, you guys. Take advantage.
Best deal ever. You got it.
So there will be discounts afterwards, but I want you to get the best deal. And that's all right. So anyway, thank you, Super Don, for indulging me just to show everybody visually what that looks like to make. We're trying to make it easy. I'm trying to make it easier. And that leads us to interesting. I was at the Holistic Dental Association this past weekend, and I was with 3 or 4 other homeopaths there. It was so cool. And we were just talking shop, having fun and interacting. Everybody's got different perspectives and angles. No 2 homeopaths are identical, just like no 2, fingerprints. Eyeballs, whatever. It's individual. I love that. And we honor the individuality of each person that comes to see us as well. But when it came to issues like surgery and recovery from surgery, I had a guy on who's a naturopath and a homeopath, and he was talking to me about his dental work, how he would put his patients on Arnica the day before.
Right.
And right before and then after. And he would have very little to no bleeding issues. And then I added phosphorus in the mix, but it's like, how exciting was it to be able to talk about it and then watch that little clip go a little bit viral in social media? Homeopathy stuff's happening. Yeah. It's great. So you could expand on that. That's just our entryway into the question of if you ever have to have surgical intervention of any kind, homeopathy doesn't have to be excluded. In fact, if you include it, you'll likely do better. You
are going to proceed through the healing journey much faster and much more complete. And that's one of the things that I think is really important for us to remember when we utilize homeopathy. Our healing journey, regardless of what that is, typically is a little bit faster and it's way more complete because it's resetting the body on a bioenergetic level. So a couple things to remember when you're going into surgery, okay? You need to have the conversation with the doctor, with the person that you are checking in with the anesthesiologist. Do not shy away from having a conversation with every single person that is going to touch the individual that's going to be having surgery. So in my case, I'll show the example of when my son went in for ACL surgery. So when we registered him from surgery, when we checked into the hospital, when I met with the anesthesiologist, when I met with the surgeon and the surgeon's nurse, All 5 of those people heard me say, no biologics, no vaccines, nothing that is in that realm at all. I also asked for a complete list of all of the medication that was going to be used. And I wanted that ahead of time. I wasn't able to get it ahead of time, but I tried to get it ahead of time. So I kind of put them on notice. Like, I want a complete list of every medication that was going to be used, because I particularly want to know exactly what's gone into my son's body. And I want to know how I can detox that on the back end. So utilizing a homeopathic detox method. That's why I don't worry if we have to go into the allopathic system, because we've got methods on the back end to help detox and reset the body. So very, very important. You have to make sure that you are letting the hospital know where you stand in terms of all of these things. No biologics, no vaccines, no mRNA, no. So that's the first thing. Then the second thing is, you want to get the person prepped for surgery. So I love that the dentist said that they use Arnica. That's what I use. And Dawn, if you want to pull up that little slide, I'm going to show everybody a slide. This comes right from my course. So you can take a look at that. So before surgery, Arnica taken, this is how I learned it. Take it the night before, the morning of, and just before the surgery. It'll help reduce anxiety, bruising, and it helps prepare for the trauma of the surgery. Anytime we are cutting into the body's barrier system, it's trauma. So that means if we're going in for surgery or if we're taking an injection, the body sees it as an invasion. It's cutting through the body's barrier. So we want to remember that. And if we're generally healthy and we've got a good constitution, we can recover from that easily. But when we're going in, especially for a major surgery, you want to give the body the signaling, the help that it needs so that it knows how to restore balance. So Arnica is that first remedy we think of for bruising, swelling. It's going to help with the soreness, and it also helps with the shock of that physical trauma. So that's going to be your core remedy. Then after surgery, after it, things come down. Now I get this question a lot. Well, do you use the pain meds, or do you try to just do it with homeopathy without the pain meds? And I think that is an individual decision. You have to determine what is the nature of the surgery, how significant it is, what all had to happen during that surgery, and whether or not you need to have the pain medication. Again, I don't worry about having to use pain meds for a day or two after surgery, because I know that I've got the tools to detox those pain meds out of the system. And what I'm concerned about is making sure that within those first couple of days of getting home from surgery, especially a major surgery like an ACL tear or a C-section or, a major, accident or something, you want to make sure that that person has rest, and those pain meds may be what's needed in order to get rest, because rest heals.
Yeah.
So I there's a balance. We have to take a balanced approach here.
Chances are too, depending on the surgical procedure, how invasive it is, it might just be a local, but a lot of times if it's a full on, general anesthesia issue, you got a lot of residual to help. You need to detoxify. So knowing these things in advance and working and preparing them homeopathically, that helps them to recover much, much more quickly. And I think even safely. There are risks associated with anesthesia, of course. And even, we know the risks with painkillers. And granted, if people are doing invasive procedures, it might be, that's where allopathic medicine has a role to play. But I've heard people genuinely using these homeopathic remedies, minimizing, sometimes eliminating the need for post-operative painkillers. At least that is a significant step.
Yep. And I've done that. I've used this same protocol with wisdom teeth surgery, where I did not have to use pain meds on the back end. For the ACL surgery, we did have to use pain meds for a couple of days, but I was using these remedies alongside those pain meds, and you can see how quickly they come back into balance, and so then you just wean them right off very quickly, and that's what we did with my son. So the after surgery, your two key remedies there are going to be Arnica and Hypericum. And Donna, I don't know if you want to bring that slide back up.
He does.
Thank you.
Just didn't know it.
So Arnica and Hypericum are going to be your two main remedies there. So you're going to take those as needed for pain management and to help to reduce the infection. You've got Hypericum, which is going to handle your nerve pain and surgical trauma to those nerve-rich areas where you may have intense shooting pain, nerve pain, you know, any kind of post-surgical nerve sensitivity. We think of Hypericum as the Arnica for the nerves. And then we're going to be utilizing Arnica continuing throughout that after surgery protocol to help the body with the trauma and the bruising and the pain associated with that surgery. Now, I have these listed, most of them in a 200. That's the potency that I generally use, but you can start with a 30C as well.
Yeah, that's an important reminder. If you don't have a 200, it's like you're not screwed. You can even have a 30C, a 30X, even a 10X or a 12X or 15. You just repeat it more frequently, typically, than a higher potency. But by all means, use the remedy you have, even if it's not the perfect potency. And I think that clinically we've seen we have adaptability.
Yes, absolutely. So Staphysagria is going to come in. That's another remedy. So you want to have these on hand when you're going into surgery, so you're prepared for post-surgery. So with Staphysagria, this is a remedy that we think of on two fronts. This is for clean surgical incisions. So that slice, that knife slice, and it's going to help the body ensure that it doesn't go into infection. But this is also a remedy from an emotional standpoint that we think of when there's been a violation. And so some people come out of surgery, even if it was an elective surgery, and they feel like they've kind of been violated. They sort of feel like they've been beat up. And so this handles both the physical and the emotional component of that, that procedure. Again, even if it is a chosen procedure, it can really kind of shake up the body a little bit. So that's what I love Staphysagria for. And, I would just maybe take, a dose a couple of times the day after surgery and then watch and see. Your Arnica and your Hypericum are going to be sort of your foundational that you're going to use throughout. And then the rest of these you're going to layer in as needed. So Nux Vomica is going to come in for anesthesia if you have trouble coming out of the anesthesia. If you've got constipation, if you kind of have this drugged feeling after surgery, upset stomach, those type of things. And again, you would use that as needed. Nausea, vomiting. Phosphorus comes in when you have the spacey feeling when you're coming off of the anesthesia. And you feel disoriented, you get headaches, and just have this very spacey feeling about it. My son did not need that for his ACL, but my daughter needed it for her wisdom tooth surgery. So it was about 2 days after, and she was like, "Mom, I don't know what's wrong with me." And she was very disoriented. And so literally 2 doses of phosphorus.
And once again, to reiterate, as these remedies are not limited to what you see on this page here, they do so much more. But as you're relating to us, Lisa, this is how you're directing their action, if you will, or acknowledging that they have action in this area. That's why they're appropriate. But as I said, phosphorus, of course, is wonderful for bleeding. If there's fever, right? Inflammation, heat, that kind of thing. So there's always something more, but I love it because this is very practical as far as, unfortunately, too many people have to go through surgical procedures because of injuries and things that happen, or the wisdom teeth. So having this at the ready can change the equation from previous experiences going through that to this. This is an amazing list. Yes. Yep,
absolutely. So your last 2 remedies there, Carbo Veg, that may come into play if you've got some abdominal discomfort or gas. There's sluggishness there present. Oftentimes that can happen as your body is getting rid of the anesthesia. It just kind of, the system gets a little bit backed up and you can get that abdominal comfort. So Carbo Veg would be a remedy that you could consider there. And then I always love to have Belladonna on hand in case there is inflammation, you start getting a fever, there's throbbing during the healing process, then Belladonna will handle that.
Wonderful.
Yeah. Now, that is your base after surgery protocol. So those are the basic remedies. Regardless of the surgery that you're going into, you want to have those.
Mm-hmm.
But you're also going to need to take a look at what type of surgery you're having. So in the case of my son, he was having ACL surgery. So there has been a very definite process that I have followed. I used those remedies coming out of surgery for that first week and a half. And then I started just shifting things, because the next thing I needed to move into was supporting the ligaments and the collagen reproduction. Right. So I'm adding remedies in, such as Ruta and Restox, and things that are really getting into those joints and the ligaments, and some of the deeper healing going on. Calc Floor was another one that we added in as well. So I've had him on a regimen. He's now 4 months post-op, and I have tweaked that regimen about every 3 weeks as he's moved into the next phase of healing.
I was thinking about going that way, and I didn't even have to prompt you. You're brilliant. The other thing I wanted to bring up is the prior to, right? We're seeing a lot of connective tissue injuries in young people and very high level athletes. And I think this is, systemic, if we will, due to the food that we have that we call food, right? It's not nutrient rich. It's not mineral rich. And we don't know necessarily how to supplement, or the key supplements we need, particularly if you're pushing your body to that highest level, as an athlete, a young athlete, even like your son. I'm not saying the ACL tear would never, ever occur. I mean, there's a force that you can go beyond, and even the strongest of us can have an injury. But in many cases, I see that there's a weakness that was unacknowledged by the allopathic profession. You've got athletes and you're looking at them, oh, you look okay, but there's no questions that are being asked about what are you doing in terms of nutrient intake to support the connective tissue, like you're talking about homeopathically afterwards for recovery. Those are the things that should be considered even going in, because you realize you're pushing your body harder than most, more along the lines of where all humans had to operate before we all became sedentary. And we can, work on a keyboard instead of being out working the land, physical activity, which was part of our human experience.
Yeah, it is making me crazy. Definitely some of the days that I'm sitting at my computer for a long time, I get up and I'm like, I've got to get out of my house. I've got to go walk outside, put my feet on the ground.
That was me yesterday, because I couldn't go to work out. I had a training sessions I was doing in the morning. And normally I like to go out first thing and do the boxing. And I'm like, by the end of the show, I'm like, to Super D and Mark D, I'm like, guys, I got to go. You guys keep on. I got to go. I get out and went to the boxing ring again. And then I went this morning. But yeah, that's the kind of thing that I didn't know growing up in America, because other than being a young athlete, despite all of my chronicities, right? You're used to, as a young person, using your body. That's why we have recreation classes, PE, physical. I mean, they've tried to eliminate that, but these were part of, and then suddenly you're an adult. Okay, now you don't have to use your body anymore.
Yeah.
Just sit down and type on a keyboard. I'm like, that is so not what we humans are designed in this physical body to do. And so we become very weak because we don't use it. But even if we do use it and we are unaware of the things we need to do to strengthen and replenish, we are vulnerable, even as young people out there. And that's the point I wanted to bring up here.
Absolutely. The question that I'm always asking, and you asked this question too, which I don't think gets asked in the allopathic community, is why? Why were you susceptible to that injury? Why were you susceptible to that flu, that cold, that, whatever it is? Why? Where did that come from? What is not working in the body for you to be able to overcome or recover that injury, that insult, that ailment, whatever it was?
Mm-hmm.
So if we're looking at depletion, especially from a connective tissue standpoint, I want to know what are they eating? What are they drinking? Are they doing all these caffeine monster drinks? I don't even know what's popular now, but
right? Yeah.
Soda. Yeah.
Phosphoric acid, depletion of mineral density, that kind of thing.
Yep.
Yeah. These are real.
What drugs are they on, and what are they depleting from the body?
Mm-hmm.
And we have to remember that if you're on something that's depleting it, or your everyday diet is depleting those nutrients from your body, you can't just add those nutrients back in at recommended daily allowance. You have to add those nutrients back in at a much higher level, and you have to make sure that your gut is working in such a way that it is absorbing those nutrients and using it for your
Yeah.
body, which is why I love the cell salts.
Mm-hmm.
Because the cell salts come in and they remineralize the body in a really beautiful way. Cardio Miracle, what another great product for helping bring, you know, all those minerals and amino acids back into the body. Copper, yes.
Mm-hmm.
Yeah, I mean, we have so many tools that we can use, you know, from homeopathy to, you know, just general products that are out on the marketplace. But we have to be cognizant of that.
Yeah, and you know, the other thing we've talked about with, you know, injuries like fractures, in addition, like comfrey, but we use symphytum as a homeopathic remedy to
Yeah.
strengthen, you know, the recovery from those injuries. Like you mentioned, rust toxin ruta. I mean, these are all things that did I have a lick understanding or knowledge or even hear those Latin words when I grew up? No, none of it. So we're still devoid of and divorced from the options that allopathic medicine, by its monopolistic dominating practices, tried to prohibit us from knowing about. And now that we do know about it, as you know, the captured agencies like FDA are trying to prohibit us from accessing the remedies if they could get away with it. And we're still having to fight and push back with Jonathan Emore, the Alliance for Natural Health, and others in this MAHA movement to say, you don't have the authority to stop us from getting it. But if we go to sleep on this issue, they will run roughshod over our rights to have choice, agency, which comes from God.
I absolutely agree with you 100%. And that is why it is very important that people understand, the more they understand how to utilize this medicine and how this medicine, like you can prepare a homeopathic remedy at home if you need to. We can craft remedies if we need to. So you know, I've got several kits. You know, if I suddenly am not able to get a hold of the nosodes, I have kits that I can graft those remedies. I can make that at home. And that's what I want everyone to be able to do. I don't want to take away from the homeopathic pharmacies. We need those pharmacies. We need to purchase from those pharmacies. But there's lots of ways that we can make remedies if we are struggling with access to remedies. But I think what's more important is that we have to step into it with the confidence in the medicine, understanding how to use it, the fortitude to not be willing to have it taken away, and the constant conversations about it within our families, our communities, so that, as we talked about before we got on the show, so that's how we start changing the generation. Because if our young adults are like, a Walgreens, I don't even know what's in a Walgreens, I'm going to the homeopathic pharmacy, then that there's no need for that. Like, we're not going to, it just kind of will fall out of favor, hopefully, one day.
Yeah. And listen, we acknowledge, both of us here, Lisa and I, talking about this, that there are a lot of layers and levels to homeopathic prescribing. If you're going for a classical similimum approach, looking for the constitutional remedy, the one thing that matches almost everything, that's a whole other level. And we've got more access to more homeopaths. I'm so excited about this. And you may resonate with Lisa, or you might not. You might talk to Lisa and go, it's okay. This is how life is. There are, you know, wide variety of people out there that can help. And I want you to have access to all of that and recognize that if we have access to homeopathy at that self-help level, which you're helping us to access with your course, it doesn't preclude the other, you know, ways we can use homeopathy. But if we can reduce our reliance on toxic, poison, allopathic suppression medicine, I think we're heading in the right direction.
Totally. I agree with you completely. And, you know, I mean, we've talked a little bit about how I work within my practice. I use a multi-method practice. I use combination remedies. I custom formulate remedies, and I use single remedies. So I kind of spread the gamut, but my method and the way that I work isn't always the best for everyone. And this is what is so beautiful about homeopathy, that I hope within the homeopathic community, we remain open and supportive to everyone's methodology and the way in which they apply homeopathy. Because the healing journey for an individual is a long journey. It's an ongoing journey. And there are going to be times when you are really working on your healing, and there are going to be times where everything is just kind of cool and you're moving along, and then something happens, and then we go back into the journey. I may be the right fit on this phase of the journey. And then down the road, there may be somebody else that is a better fit. And we just need to be, as homeopaths, willing to hand off and take on and just allow our clients to move between the different methodologies and the different practitioners, you really have to make sure that you resonate with your practitioner so that they can move with you along your healing journey. And
Yeah.
there's just no benefit. I mean, I have been admonished extraordinarily by homeopaths, mentors, for the way in which I apply homeopathy in my practice.
Mhm.
And there's no room for that. There's
No,
like
you
nobody
would,
benefits from that.
as I said, the moment we connected, I said, you have very unique, special gifts in homeopathy that are distinct and different from mine. Some might say better. Some might say I don't look at it that way. I'm looking at it. How do we meet the needs of all the people out there? Well, if we go to one size fits all, we're as bad as the allopaths.
Right.
And, like my mom, no, in this case, my wife, she discovered, when she asked the question about, the wide varieties of medicines out there and the allopaths and what they're doing with COVID. And the answer she got from Spirit was there's a medicine for every state of consciousness. There's a method for every state of consciousness.
Yeah.
Even those who are inclined now to say, hey, I'd like to try homeopathy, they might not go to that deepest level where we know it can go. And they're like, no, I like what you guys are talking. It's easy to access. I feel comfortable. Cool. And then at a certain point, you might be encouraged to go further. I've always found that the method that I learned, that clinical drainage approach, was a kind of a stair-step progression, if you will, to open people up in a way that they weren't before, just like I had to be opened up. Clearing the terrain, that concept that I always love to talk about from Antoine Béchamp and Claude Bernard, the people I never learned about in high school and college. So for me, these things open us up to deeper levels and layers when we're ready. If we hit it a moment too soon, either nothing happens or we end up in crisis. And in either case, we say homeopathy is horrible, it sucks, it doesn't work, whatever. So the openness to the wide variety of ways this can be, molded into meet the needs of the individual at that moment in time.
Yeah, absolutely. And that homeopathic journey for the person, once you start, I agree with you. I approach it from what are the pathways that we need to open up. That's one of the first things that I take a look at. And the other thing that people experience on the journey is sometimes it's a little rough of a journey because when the remedies start to open things up, things come to the fore that we have to deal with. And then going back to that clip that you had, that gives us the opportunity to go back and work through that challenge that had been suppressed.
Yes.
At some other point in our history. So sometimes there's a little bit of like, moving. I want it to be a beautiful journey for everyone, but sometimes it is a hard journey.
It's not always pretty.
Yep, and that's when we have to layer in these different techniques to help move them through those different phases of the healing journey.
Well, that leads us to today's homeopathic hit. I can't believe we didn't cover this one, but this covers a lot of symptoms.
Right.
Check this out, the homeopathic hit of the day.
Playing all of the homeopathic hits every day, right here on the Robert Scott Bell Show.
Well, I get to say thanks to all those folks that support this message of health, freedom, healing, liberty, and the homeopathic hits, including, of course, Lisa Rooney's right here with us, but also Better Way Health, an immune modulating supplement that is, I believe, as safe as a homeopathic remedy. My kids have grown up with it. They've never had to resort to antibiotics. That's one of the reasons why. You guys can check it out, betterwayhealth.com. You can tap into their gummies for kids. When the kids get old enough, they can swallow capsules. They got the 100 strength, the 500 strength, anything in between. And I sent a bunch of gifts to Super D and Mark D, and they've got some things to explore because there's a lot Better Way Health has. So check it out. We also talk about Lisa Rooney. Also, we have a new option. You guys want to go really far with your homeopathic experiences. There are physicians that are even licensed, if that's important to you, that have been pre-qualified by our friends there at Global Natural Health Solutions, GNHShealing.com, opening up the possibilities wider and wider for homeopathy. I'm so excited. They have a $240 discount code for getting a serious consultation, RSB 240. So check them out as well. Click the QR code there or whatever, or scan it. And also RC Herbals, the official herbal company of the Robert Scott Bell Show now, Ridgecrest Herbals. And they're going to be with me at the Be Healthy Utah event this Friday and Saturday. Hopefully I can interview some more of them so we can learn more about the wide variety of products, including my favorite, their clear lungs. So we got that. Let's go. Let's dive deep into Carbolica Macetum in the little time we have left with Lisa Rooney. The PDF is there for you to download for free. It's a nasty one. Putrid discharge. tissue destruction, central nervous system depression remedy, stop you breathing, stop. This is a pretty potent thing, this carbolic acid from phenol. If you were exposed to it, there are a lot of symptoms that manifest. It's not a mild remedy. Check all this stuff out. Central nervous system depression, mental physical languor, as they say, odor. A lot of odor stuff comes up in this one. Putrid, foul, offensive discharges. It mentions certain diseases by naming for treatment. Scarlet fever, diphtheria. Remember, we got DPT or DTaP shot. Diphtheria indicated. We've got a remedy for that. Nasal ulcerations, discharge again, mouth and throat, really shriveling up the uvula. Oh, that sounds nasty. Gastric loss of appetite, nausea, vomiting. Again, nasty stuff coming out of you. Sounds like, The Exorcist, the pea soup coming out of Linda Blair. Abdominal distension also included here. So it's not subtle, and it keeps going. Stool disturbances, both constipation and diarrhea show up here. Urinary issues, female-specific discharges, not so nice. Also extremities and skin stuff. Okay, so the Borky recommends a wide variety of potencies, 3C to 30C, but utilizing it as a low potency, be careful with this one. And then we extrapolate based on the symptoms, and we find out there are other remedies like baptisia, creosotum, arsenicum, carbo veg, mercurius solubis. What are the ones I added this morning? I don't know what happened to that. But anyway, here we are, Lisa Rooney. I don't know if you've worked with carbolicum acidum, but it's a pretty intense remedy.
I have never had to work with this remedy.
Thankfully, that means you haven't come across some of the most putrid, horrible discharges that patients are, hey, look what came out of me, Lisa.
Right. I haven't had to work with this remedy, but that's what comes up. I mean, this is a really collapsed state, probably high toxicity and just everything is collapsing. Everything is just collapsing. That's the word that keeps coming up. It's just
function is stopping. You're no longer breathing. I mean, you think about a remedy like that, they're probably not even able to come see you when they're in this state. It's an interesting intensity with this remedy.
Yeah. What I read was the system is shutting down under the toxic load. That was the statement that I saw. And, I always like to look at it from a mental, emotional standpoint, because that's kind of my jam. But I see this as like a really depleted phosphoric acid state.
Yes.
So this probably moves way beyond that phosphoric acid state, where they're just in a very mentally depleted state, and now the body's starting to shut down.
Yeah. So you guys want to study up on that remedy. It's not one, again, that I've used frequently either, but it's nice to know that it's there. If you ever encounter that, or if that happens to you, we know we can go to various stages of intensity and severity. There are remedies to match. And I like the fact that it even mentioned diphtheria, right? When you hear about these old things that are in vaccines, like, oh, there's nothing for diphtheria. Well, look at the homeopathic Materias Medica and how many ailments, illnesses, diseases that they've claimed on the allopathic side. There's no treatment. We have remedies for that.
Absolutely. And one of the things that I would do with a remedy like this, you listed a handful of remedies that it's similar to. That's when I like to go in and do a differentiation. And you can, and just keep that in a chart for collapsed states, differentiation. So you can really see when are you in the different state, and when you need that particular remedy versus maybe arsenicum or, pyrogenium or another remedy that you listed. So that's another good way for your audience when you've got these homeopathic hits and they're trying to decide, well, when would I use that?
Right.
Let's do a differentiation with other remedies that also handle that collapsed state.
Yeah.
So you know where you're at on that kind of spectrum.
Yes. And in these short hits, of course, we can't go into depth, but that's the point of putting those adjuncts to look and say, I'm not sure. There's something in there that looks good, but I don't know. So we look at those other ones and go, something might be resonating and meeting it much better. And that's where we, process of discovery and research. Or if we don't have the time or energy or effort to do it, then we reach out to someone like Lisa Rooney or the other homeopaths that are coming on board here. So very exciting, all the opportunities that are happening.
Yeah, it's very exciting. I love it. Lots of good conversations.
Dude, this is awesome.